Visit licensureexams.com and try our samples completely free of charge.
We were just involved in a webinar presented by Barton Bot on acute stress disorder, and in the Zoom chat section, one of the participants wanted more specific information on ADHD, which has similar characteristics. So here goes. As mental health professionals, understanding this complex neurodevelopmental disorder is crucial for providing effective treatment for clients. Today, we'll explore the multifaceted nature of ADHD, its impact on clients across the lifespan, and evidence-based approaches to treatment. First, let's examine the possible etiology of the disorder. Research indicates that ADHD has a strong genetic component, with heritability estimated at around 74%. Environmental factors such as maternal substance use during pregnancy, exposure to environmental toxins, and early childhood adversity may also contribute to its development. Brain imaging studies have revealed differences in neural circuits involved in attention, executive function, and reward processing. Main premise and process. ADHD is fundamentally a disorder of executive functioning and self-regulation. These challenges manifest in three primary domains: attention, regulation, behavioral inhibition, and activity level. The disorder impacts multiple life areas, including academic performance, social relationships, occupational functioning, and daily living activities. The process of ADHD begins in early childhood, though it may not be diagnosed until later. The brain's executive function network, centered in the prefrontal cortex, develops more slowly in clients with ADHD. This delayed development affects working memory, emotional regulation, organization, and time management. What makes ADHD particularly complex is its presentation across different contexts. A child might show excellent focus during highly stimulating activities, but struggle significantly with routine tasks. The disorder isn't simply about inability to pay attention. It's about difficulty regulating attention appropriately based on situational demands. Recent research has highlighted the role of the default mode network in ADHD. This neural network, active during rest and mind wandering, shows altered connectivity patterns in clients with ADHD. Understanding this neurological basis helps explain why traditional behavioral interventions alone may not be sufficient for comprehensive treatment. Additionally, ADHD often presents differently across genders. Girls typically show more inattentive symptoms and less hyperactivity, which can lead to underdiagnosis. The disorder also frequently co-occurs with other conditions such as anxiety, depression, and learning disabilities, necessitating careful differential diagnosis and integrated treatment approaches. DSM-5-TR criteria. The DSM-5-TR maintains the core diagnostic structure for ADHD while providing additional clarification and context. The disorder is characterized by a persistent pattern of inattention and/or hyperactivity, impulsivity, that interferes with functioning or development. Symptoms are present in multiple settings. The criteria are organized into two main symptom domains: inattention and hyperactivity, impulsivity. For the inattention domain, 6 or more symptoms, 5 for clients age 17 and older, must persist for at least 6 months. These symptoms include failing to give close attention to details or making careless mistakes, difficulty sustaining attention in tasks or play activities, not seeming to listen when directly spoken to, not following through on instructions and failing to finish tasks, difficulty organizing tasks and activities, avoiding tasks requiring sustained mental effort, losing necessary items, being easily distracted by extraneous stimuli, and being forgetful in daily activities. For the hyperactivity, impulsivity domain, 6 or more symptoms, 5 for clients age 17 and older, must persist for at least 6 months. These symptoms include fidgeting or tapping hands and or feet. Leaving their seat when remaining seated is expected. Running or climbing in inappropriate situations, difficulty engaging in leisure activities quietly. Being on the go, or acting as if driven by a motor, talking excessively, blurting out answers, difficulty waiting turn, and interrupting or intruding on others. The DSM-5-TR specifies that several symptoms must have been present before age 12, must be present in 2 or more settings, such as home, school, work, or with friends and or relatives, and must clearly interfere with social, academic, or occupational functioning. The symptoms must not occur exclusively during the course of schizophrenia or another psychotic disorder and should not be better explained by another mental disorder. The DSM-5-TR identifies 3 presentation specifiers. Combined presentation if both inattention and hyperactivity, impulsivity criteria are met. Predominantly inattentive presentation if inattention criteria are met but hyperactivity impulsivity criteria are not, and predominantly hyperactive impulsive presentation if hyperactivity impulsivity criteria are met but inattention criteria are not. Severity is specified as mild, moderate, or severe based on the number of symptoms and degree of functional impairment. The DSM-5-TR also emphasizes the importance of noting partial remission where appropriate and includes remission specifiers. It acknowledges that symptoms may change over time and that adult presentation often differs from childhood manifestation. The criteria include consideration of cultural factors and gender differences in presentation, noting that ADHD may present differently across various populations. Additionally, the DSM emphasizes the importance of considering comorbid conditions, as ADHD frequently co-occurs with other neurodevelopmental, mental, and behavioral disorders. Assessment of ADHD. A comprehensive ADHD assessment begins with a thorough clinical interview that includes detailed developmental history, family history, and current functioning across different life domains. During the initial evaluation, therapists often start with the adult ADHD self-report scale for adults or the Conners rating scales for children and adolescents, as these provide valuable screening information and align with DSM criteria. For a more detailed evaluation, therapists typically employ the Brown Attention Deficit Disorder scales, which specifically assess executive function impairments across various domains, including activation, focus, effort, emotion, memory, and action. The Behavior Rating Inventory of Executive Function, or BRIEF, provides additional insights into executive functioning in real-world settings, examining areas such as working memory, inhibitory control, and emotional regulation. To assess functional impact across different environments, therapists often utilize the Weiss Functional Impairment Rating Scale, which examines how ADHD affects family relationships, work performance, academic achievement, life skills, self-concept, and social activities. For students, the inclusion of both home and school situation questionnaires helps identify specific challenging contexts and guides intervention planning. Continuous performance tests, like the Test of Variables of Attention or Conners Continuous Performance Test, offer objective measures of attention and impulse control. These computerized assessments are particularly valuable as they provide quantitative data about attention patterns and response consistency over time. For a comprehensive understanding of behavior and personality, especially in children and adolescents, the Behavior Assessment System for Children proves invaluable. This tool incorporates input from multiple sources, including parents, teachers, and self-reports, providing a well-rounded view of functioning across different settings. When academic concerns are present, the Woodcock-Johnson tests of achievement can help evaluate the educational impact of ADHD symptoms and inform educational accommodations. Additionally, to address potential comorbid conditions, therapists might include depression and anxiety screenings. Throughout the assessment process, therapists must maintain careful documentation of behavioral observations, symptom patterns, and functional impairments across different settings. They should also consider cultural factors that might influence symptom presentation and interpretation. Regular reassessment using these tools helps monitor treatment progress and adjust interventions as needed. This comprehensive approach ensures that treatment plans are tailored to each individual's specific needs and challenges. Techniques for working with ADHD clients. When working with ADHD clients, a multimodal treatment approach typically yields the best results. Begin with a thorough assessment including standardized measures and clinical observation across different settings. Collaborate with other professionals such as schools, primary care physicians, and occupational therapists to gather comprehensive information. Cognitive behavioral therapy adapted for ADHD has shown significant effectiveness. Focus on developing specific strategies for organization, time management, and task completion. Help clients break down large tasks into manageable steps and create external structures to support executive functioning. Implementation of behavioral strategies should be gradual and consistent. Teach clients to use tools like timers, calendars, and reminder systems. However, remember that the goal isn't to eliminate ADHD symptoms, but to build compensatory strategies and enhance functioning. Environmental modifications play a crucial role in treatment. Work with clients to identify and minimize distractions in their work and study spaces. Instruct them to recognize their optimal times of day for different types of tasks and to structure their schedules accordingly. Emotional regulation training is often overlooked but essential. Many clients with ADHD struggle with emotional impulsivity and rejection sensitivity. Incorporate mindfulness techniques and emotion identification exercises into your treatment plan. For children, parent training is crucial. Teach parents to provide clear, consistent expectations and immediate feedback. Help them establish routines and structure while maintaining flexibility for their child's needs. Emphasize the importance of positive reinforcement and celebration of small successes. Medication management, while outside our scope of practice, often plays a vital role in treatment. Terms and definitions. Executive functions is defined as higher-order cognitive processes that enable goal-directed behavior, including working memory, cognitive flexibility, and inhibitory control. Hyperactivity, excessive physical movement and restlessness of a client that exceeds what's typical for developmental level. Impulsivity, acting without forethought or consideration of consequences, often manifesting as interrupting, having difficulty waiting for a turn, or making hasty decisions. Inattention, difficulty sustaining focus, following through on tasks, and organizing activities. Working memory, the ability to hold and manipulate information in mind over short periods. Time blindness, difficulty perceiving and managing time effectively, a common feature of ADHD. Executive function disorder, broader term encompassing difficulties with planning, organization, and self-regulation. Hyperfocus, intense concentration on activities of interest, sometimes to the exclusion of other important tasks. Mental status exam areas that might indicate ADHD. During the mental status exam, several areas may suggest the presence of ADHD. Observe the client's attention and concentration throughout the session. Note any difficulty maintaining focus during conversation or tendency to shift topics frequently. Assessment of behavior and psychomotor activity is crucial. Look for restlessness, fidgeting, or difficulty remaining seated when appropriate for age and context. Observe speech patterns for rapid pace, tendency to interrupt, or difficulty maintaining coherent narrative flow. Evaluate thought processes for tangentiality or circumstantiality. Clients may have difficulty organizing thoughts or maintaining a linear conversation. Memory function. Working memory may impair holding and manipulating information. Note the client's insight into their difficulties and judgment regarding daily decisions. Many clients with ADHD are aware of their challenges but struggle to consistently implement effective solutions. Observe affect regulation and any signs of frustration or emotional lability. Pay attention to how the client handles transitions during the session and their ability to shift between topics or tasks. Remember that mastering ADHD treatment concepts builds a foundation for helping countless clients achieve their potential. Your dedication to understanding this complex disorder will make a real difference in people's lives. Hope this has been helpful, and remember, success on your licensure exam comes from consistent study and understanding core concepts. It's in there